Hi, my name is Sara Robertson, and for this project I chose a journal article, and it was titled Cross-Culture Communication Barriers in Healthcare, and it was written by Sheena Taylor, Colette Nicole, and Martin McGuire. This particular study looks at ethnic minorities and the communication problems that providers are having. The methods used for this particular study were just open-ended questions, and I really liked that because it kind of reminded me of Chapter 7. So the research people were actually utilizing some of the techniques on open-ended questions where the providers didn't feel there was a right or wrong answer. They could be really candid with how they felt about the situation. I thought that was a brilliant way to go about asking in a survey where they don't feel they're inclined to answer one way or another. This particular study used an inclusive design, which means they wanted the widest variety of people they could get to gain the most information. Again, another really great aspect of this research study. So they didn't just go to one hospital, they went to 5. And they also didn't just choose one particular provider, say a physician or a nurse. They took physicians, nurses, receptionists, and they got everybody's information. Another great thing about this study is they had a wonderful age range from 25 to 60, and they also challenged their research by introducing ethnic differences within that as well as generational differences. So some first generation and second generation providers were included in this study. The thing that I really enjoyed about this article is most of the journal articles have researched it from the perspective of the patients. This one takes the providers, so the doctors, the nurses, and they ask them what has been their experience dealing with patients who have either no English or who have some other literacy issue. A lot of the findings in this particular study coincide with some of the issues we saw in Chapter 13, such things like with literacy issues, be it in vocabulary or just knowledge. Patients suffered from anxiety. They also weren't very clear on their treatment plans. A lot of them actually took the wrong dosages of medicine, as well as an interesting aspect that the doctors said, and nurses as well as receptionists, that their workflow was hindered. Even though we don't want to think of it as a negative thing, we still have to think about cost. With the healthcare system seeing so many people, when the workflow of all these people get hindered because they're trying to compensate for illiteracy issues, it can really put a hindrance on hospitals. Thinking back to Chapter 4 of our textbook with healthcare disparities, one interesting thing in terms of culture, there was 2 reoccurring themes when it comes to culture in this study. There was the individualistic versus the collective culture. So those patients that were fine with having family members and those family members helped with the interpreting versus those that were very independent and didn't want a whole lot of assistance. Those created a lot of issues or help when it came to this study. The concluding findings or discussion in this particular study addressed the simple fact that in order to deal with these, it needs to start in-house. It needs to start with the providers and really figuring out ways to address the issues that keep coming up. Statements that nurse number 5 made when asked about the language barriers and how they affect her job. She quoted, "Communication is 99% of our job." That statement alone says so much, and it's definitely something that we need to think about. So the 5 questions that I have to ask are, how much of your workflow is hindered by literacy issues? Do you think it's realistic for ethnic minority groups to learn English? What realistic options do providers have to help empower their patients? And what new approaches to literacy barriers do you find realistic to implement in your current industry? And last, do you notice more collective or individualistic cultures in your industry?